The novel coronavirus COVID-19 has proven how connected we are. A virus which started in Asia has spread across the globe, impacting countries on each continent of the earth. Globalization has made each other just a plane away. Now, with social distancing, the world is being forced to connect through the net. Whether you have joined us online or via the TV, we are glad that you have connected with us today. We will get through this period of uncertainty with the right facts and by uniting. Today we share the myths, tips and information you should know to fight COVID-19. So stay with us. I'm Adrian Atkinson and this is Jamaica Magazine.
Practice good hygiene by washing your hands frequently using soap and water. Here's how you should do it while conserving water. Turn on the tap to wet your hands, then turn off the pipe. Lather your hands and the tap with soap. Turn on the tap and wash your hands, back, front, and in between fingers. Use some of the water to wash off the tap, then turn it off. Dry your hands with disposable hand towels. If you don't have running water, use a hand rub containing 62% or more alcohol. If hand sanitizers are not available, rubbing alcohol, Dettol, white rum, or household bleach will do the trick. And if all else fails, let hand washing and the handling of potable water be a two-person event. Each person will take turns pouring and washing hands with sitting water. Now is a good time to consider installing a tap on your containers to reduce the risk of water contamination. Faucets can be easily attached to drums, buckets, or 5-gallon water bottles. And to ensure that the outside of the containers are clean when recapping, disinfect it with hand rub containing alcohol that's 62% or more. The 5 R's of water conservation are also necessary to practice. Reduce water wastage by investing in water-saving devices. Reuse water at least twice before discarding. Replace leaking pipes, faucets, and other plumbing equipment. Recycle wastewater and use it for gardening, car washing, or cleaning of public spaces. And reclaim water through rainwater harvesting. We all must play our part to ensure there's water to combat the coronavirus and stave off prolonged drought.
Before COVID-19, if someone said quarantine, many people likely thought about solitary confinement or military control. Now, quarantine has become a buzzword. Its meaning extends to the home, a community, as well as health facilities. But just what does it mean?
The purpose of quarantine is to closely monitor patients so that symptoms can be picked up early and the appropriate measures taken.
This tool of public health, quarantine, works by separating and restricting the movement of people who may have been exposed to a contagious disease to see if they become sick. As many countries, and eventually Jamaica, began to grapple with the introduction of a new strain of the coronavirus called COVID-19, quarantine has been one of the measures implemented. In Jamaica, it begins at our ports of entry. Government assessed the risks and identified several countries that posed the greatest risk to introducing the virus on the island through travel from their citizens or Jamaicans in the diaspora. Travel was restricted, and those granted landing privileges were assessed and determined if they needed to be quarantined. Persons are generally placed in quarantine for the established incubation period of the particular disease. As it relates to COVID-19, that's 14 days.
When we place persons in quarantine, what we want to do is to monitor on a daily basis and to ensure that if there are any symptoms that are developing, we pick it up early before the person reach to a point where they are coughing or sneezing and are more likely to be able to spread the virus.
There are, in general, 2 ways in which persons can be quarantined: in a government facility or at home.
The process of quarantine persons at home is not a simple one that we just send persons home. The homes are investigated by the health departments. We ensure that there is adequate space for the person to remain far away from other persons, and we ensure that the person is educated as to how it is that they conduct themselves, how it is that they move around. We ensure that the family is also educated, and then the health department checks on this patient on a daily basis. Now that check may mean that the person may be given a thermometer, and they're asked to check their temperatures, and they're given a log that they monitor their symptoms, and this is reviewed by the health department on a daily basis. If necessary, the health department visits the home on a daily basis as well. So we restrict persons who are in quarantine from going outside of their homes. And essentially in a home, what you really need is just a room and an adjoining bathroom. The general precautions in terms of making sure that you keep your distance, 3 feet is what we recommend. The person who is at home who of course does not want to spread any possible thing that they may have to their relatives will take the necessary precautions. In terms of, some of them may wear a mask, okay, to prevent. If they're talking to their relatives or friends, they may choose to wear a mask. The washing of hands is very, very important, because any kind of droplets that get on your hand, you can transfer to your face, and you can therefore get it into your ear passages or into the eyes and cause an infection. So the washing of hands, making sure that you have that facility, and also for hand sanitization, if you don't wash immediately, that is also recommended.
As at March 17, there are 4 government quarantine facilities across the island.
Essentially, for a quarantine facility, what we really need is that the person is separated from other persons and there is minimum contact.
When persons are quarantined at one of these national facilities, they are kept in a room and monitored daily by members of a healthcare team. They are fed and their daily needs met during the quarantine period. In some cases, a third form of quarantine may be required: the quarantine of an entire community. For instance, approximately 12,000 residents of 7 and 8 miles in Bull Bay St. Andrew are now under quarantine, following news there was community spread leading from the first person to test positive for the novel coronavirus in Jamaica. Like home and self-quarantine, residents are required to be quarantined in their homes for 14 days. They are required to remain inside their houses and not wander about in the community unless necessary. They must remain within the mapped-out boundaries of the community, which are now manned by the security forces. During the period, government will deliver care packages to the residents, which include food, water, and in some cases, medicine. They are also educated on what is happening to them, what to expect, and how to prevent the situation from escalating. Whether persons are in home or government facility quarantine, it is important that they abide by the quarantine guidelines, maintain a positive attitude, and contact the Ministry of Health and Wellness COVID-19 helplines if someone in the household gets sick.
Tip number 1. Keep your regular medication and other supplies well stocked. Ensure there is access to several weeks of medications and supplies in case there is a need for you to stay home. Monitor food and other medical supplies needed and create a plan in the event that such resources become depleted. Tip number 2. Stay sanitized. Tip number 3. Respond to multi-generational living situations. Many older adults live in homes where other members, such as children, may have frequent colds. Therefore, do not share personal items like food, water bottles, and utensils. If possible, choose a room in your home that can be used to separate sick household members from those who are healthy. Tip number 4. Develop intentional caregiver plans. Older adults may be caregivers or may receive care themselves. caregivers and care recipients should discuss their preparation plans, including how to stay in touch via phone or email. Determine who can provide you with care if your caregiver gets sick. And tip number 5, keep abreast of essential up-to-date information. That means you should find and regularly check a trusted information source.
The government has implemented a policy for isolation, another level in the COVID-19 response. We have all the details next.
Isolation speaks more to persons who display symptoms, flu-like symptoms, and are therefore placed in a hospital setting under hospital supervision to treat with those symptoms, but at the same time to validate or rule out any possibility of them having the virus.
It's very important that we pick up these symptoms early so that we can isolate these patients. Under isolation conditions now, if this person continues to develop symptoms, then this person would be separated from other persons who they could pass the virus onto, and they will be nursed in a controlled situation to prevent any spread, either to other members of the public or to healthcare professionals.
Government, utilizing the available powers under the laws of Jamaica, instituted protocols for immediate isolation of persons entering the island exhibiting flu-like symptoms.
In terms of moving a patient to isolation, if they have come from an area of concern and they had any symptoms when they landed, we would have moved them into isolation. That is our protocol. And the symptoms, when we had put any symptoms, is out of an abundance of precaution.
On the grounds at the community level, where persons may have returned from countries with the virus and may have made contact with the wider community, quarantine and monitoring at home for symptoms will take place, and where symptoms are exhibited, they are isolated and testing is done. Isolation serves the same purpose as quarantine in that it keeps infected people away from those who are healthy to prevent the virus from spreading. However, it is reserved for those who are already sick and provides for treatment and recovery, usually in a hospital setting. When you are placed in isolation, the following is done.
We test persons who are ill that fit a particular, what we call a case definition. So you have to have all the criteria that is required for testing. If you meet that, then you are tested. And the test is done at the National Influenza Center. It's what we call a respiratory sample. So the mucus that we'll get from the lining is what is taken and then sent to the National Influenza Center, and it's what it called a PCR test is done on it.
In isolation, what we have now is definitely a more restricted conditions. So we would have a room that is essentially sealed off from the rest of the hospital facility or whatever facility it is in, okay? Persons who enter into that bubble have to be completely protected, okay? So they protect themselves by wearing mask. They may wear a cap to cover the hair. They may wear face shield. They may wear gowns. It all depends on what kind of symptoms the person is having. For example, if you have somebody that is coughing a lot and there's a lot of droplets, then you are going to take more precautions, okay? So the persons that are entering into that room to interact with the patient have to make sure that they're fully protected. So they usually don those personal protective equipment on going in, and then on coming out, they remove all of those things and discard them. There are certain conditions under which we may isolate persons together. For example, if they're close family members and both are suspected to be infected and have the same kind of course together. So we may choose to isolate persons like that together. But for the most part, we will separate persons.
Isolation facilities have been set up in all hospitals across the island. Home isolation is possible only where persons with COVID-19 are well enough to receive care at home and there is an appropriate caregiver, a self-contained bedroom and bathroom where the patient can recover without sharing an immediate space with others, and there is access to personal protective gear. Regular cleaning, sanitizing, and disinfecting of all areas of the home, including high-touch areas, should be done daily.
I can tell you, it's not easy. When we rescued the 21 Honduran kids, ages 13 to 15, yes, what we found was visible gunshot wounds on them, pus and flies in them. And it was real Christmas time, so we spent our Christmas that year tending to 21 kids and trying to talk to kids who could not speak English. They didn't even speak Spanish and were from Honduras. They spoke a language called Mosquito. It's an impossible language to learn. So we had to fly a private craft from Norma Manley here to Tegucigalpa in Honduras to have them sent back safely.
If you know of someone who is being trafficked, call the Counter-Terrorism and Organized Crime Arm of the Jamaica Constabulary Force at 876-967-5627 or 876-967-1389.
There have been many myths surrounding the coronavirus disease, the same one now officially known as COVID-19. I've heard that Jamaica's temperature is too hot, so COVID-19 won't survive here, or that you need to eat garlic to help prevent you from being infected. I know you've also heard some stuff and may even believe half or more of what you've heard. So let's take some time and debunk the myths of coronavirus. People have said that the novel coronavirus cannot be transmitted in the heat. That is a lie. The virus can be transmitted in all areas, including those with hot and humid weather like Jamaica. Another myth is that it can be transmitted through a mosquito bite. To date, there has been no information or evidence to suggest that the new coronavirus could be transmitted by mosquitoes. This one has been very popular. Only old people can contract the coronavirus. Do not be fooled. People of all ages can be infected by the new coronavirus. However, older people, particularly those with pre-existing medical conditions like asthma, diabetes, and heart disease, appear to be more vulnerable to becoming severely ill with the virus. This is another popular one. Eat more garlic, you won't catch the virus. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. These are just some of the myths that surround the coronavirus. Make sure you take time out to know your facts and do what needs to be done as we all try to contain the spread of this disease.
I wish to emphasize that the success of our efforts is contingent on the support of all Jamaicans, including the deliberate efforts to access and share accurate information on the virus, thus helping to minimize the fears and anxiety that has been associated with the spread of the COVID-19. At the same time, we must, in keeping with good hygiene, maintain a distance of at least 2 meters from persons who are coughing or sneezing, frequently perform hand hygiene by washing hands thoroughly with soap and water or using a hand sanitizer if hands are not visibly soiled, cover our mouths and noses when coughing or sneezing with a tissue and then discarding it, and avoid touching our faces and each other unnecessarily.
You heard the Health Minister. Let's play our part while building those immune systems as we tackle this virus together.
An important message from the Ministry of Health and Wellness. What to do if you think you have been exposed or are experiencing signs and symptoms of COVID-19. Immediately call 888-1-LOVE. That's 888-663-5683. In addition, you should stay at home. Don't go to work, school, or any public place. Do not use public transport, and avoid visitors to your home. You may need to do this for up to 14 days to reduce the spread of the infection. A message from the Ministry of Health and Wellness.
Next, we delve into government's 5-point strategy to contain the spread of the novel coronavirus.
The novel coronavirus, or COVID-19, is now present in our island. The government has been taking a proactive approach to prevent the spread to communities. On today's program, we learn just what those plans are and much more about this novel strain of virus from an expert voice, Dr. Jacqueline Bisesa McKenzie, who is the Chief Medical Officer in the Ministry of Health and Wellness. Dr. Bisesa McKenzie, welcome to the program.
Thank you.
Good. Tell us about the strategies that government is using to combat this spread.
Okay. Well, as most persons are aware, our main strategy focused around delay. And we're still at delaying the numbers from increasing. First of all, it was delay in getting the virus being in the country. Now it is delaying that increase in the numbers. So stepping on from delay, of course, is containment. So once the virus is in the country, what we are trying to do is to minimize spread of the virus and to contain it within that very small area that it is. Then, of course, we have to manage. All right, we have to manage the cases. We have to manage the public in terms of their awareness and how they themselves respond, separate from how the health system responds. And then, of course, we have to recover. And the important part about recovery is recovery in a better position than you were before. So those are our main objectives: delay, contain, manage, and then recover. But then in terms of our strategies that we use to ensure that these objectives are met, we have 5 main strategies. First of all, planning and coordination. And that starts even before there is any event that is happening in country. And this is about setting up a robust response mechanism within the health sector, and also how that is coordinated with a national response. And so we have our Emergency Operations Center that has been active, as you know, since dengue. So we were in operations, and then we have COVID. So now we're in 24-hour full activation, and our aim is to coordinate the response of the health sector, not just in terms of the public health sector, but also the private health sector, and also bringing in all the other stakeholders in health.
Right.
So our next strategy is in terms of surveillance and monitoring. And this again starts right from the beginning in terms of where was this virus expected to come from? It was expected to come from outside of our shores. And so therefore, the monitoring of our ports of entry was very key. And that enhanced surveillance we have going. I mean, many persons are aware of our activities in terms of yellow fever, malaria response. And in that, you know, in protecting our borders, we have a public health team and a public health presence. But it is not just the public health, it's a coordination with all the persons that are responsible for protecting our borders. Key to this is our coordination with immigrations, because immigrations are the ones that are the first step. So in order to detect persons at our borders, we have to maintain this strengthened position and also to increase it around the country. So right now, I would say to everybody in the population, anybody who has a cough or cold, evidence of a viral illness, they should stay home.
Thank you so very much for coming in to share with us on this very important matter, COVID-19.
Okay, thank you, and stay safe.
This has been Jamaica Magazine. Our guest was Dr. Jacqueline Bisesa McKenzie, Chief Medical Officer in the Ministry of Health and Wellness. While the new coronavirus, or COVID-19, is a virus that can cause death, in many cases, those affected can survive. Remember to always wash your hands, cover your mouth when you cough or sneeze, and always clean all high-touch surfaces. Stay away from crowded areas. Let's work together to conquer this health threat. Until next time, I'm Rose Campbell. Take good care.
The National Solid Waste Management Authority, NSWMA, wishes to advise the public that the Mandela Park in St. Andrew is closed. This is in adherence with government's restrictions on gatherings in public spaces. The halfway tree-based park will be closed until further notice. The NSWMA will continue to closely monitor the announcements of the Ministry of Health and Wellness to make decisions in the best interest of the citizens of Jamaica.
During this period of COVID-19 containment, solid waste management is crucial. The NSWMA has provided some solid tips for proper disposal. Watch this.
Solid waste management is a critical component of curtailing local transmission of COVID-19. As householders strive to keep their homes and frequently used surfaces clean, domestic garbage collection is now even more important. The National Solid Waste Management Authority, NSWMA, has called on citizens to partner with the agency in taking all measures possible to contain the spread of this virus. The recommended actions to support the sanitation crews are securing household garbage by properly bagging, tying, and placing in a container for collection, double bagging garbage containing tissue, gloves, face masks, and diapers, placing storage receptacles at the front of the premises where they can be accessed without hindrance 24 hours per day. Persons with uncollected garbage are also encouraged to contact the agency through the following media. Call toll-free at 888-CLEAN-JA, that's 888-253-2652, or WhatsApp 876-448-3220. Or email nswma@nswma.gov.jm. Visit the agency's website www.nswma.gov.jm and reach out on Twitter, Instagram, and Facebook. The NSWMA continues to work closely with the Ministries of Local Government and Health to ensure the welfare of employees and the citizens of Jamaica.
This has been a production of the Jamaica Information Service, the voice of Jamaica.